All right. Well, good morning, everyone. It is Monday, April 3rd at 9:02 a.m. Thank you guys very much for being on the call this morning. As always, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission, and thank you for being live on the set here. And we appreciate you guys taking time this morning as we enter into lock-in. So we are officially done with OEP. We're going to talk about that today. We're going to talk about lock-in, what you should be doing to keep the wheels moving, and then also preparing yourself for the next selling season, which comes up in October. And we have some great things to talk about this morning, as well as this special guest. We have Shannon from WellMed and Optum, who is going to give us a quick update on all the great things that they've got going on right now, and to introduce or reintroduce herself so you can connect with a physician group that matters to your clients. Okay. All right. So as we normally do, we've got to keep going. We've got to keep in the know. And in order to do that, we've got to keep one foot in the classroom and the other one in the field at all times. And with that, I'm going to share the training calendar. Just a quick reminder, guys, if you don't have the training calendar hooked up to your phone, laptop, iPad, please reach out to support@askhpm.com, and we will connect you with somebody there to get you that calendar, so you know what's going on with the training world. I will tell you that training is going to start picking up here as we get closer and closer to June. June, as you know, is the recertification month. So we're going to have all sorts of fun recertifications happening across all the plans. So this is a really great time of year to double down and get your chops right. Okay. So if you want to improve yourself as a salesperson, if you want to improve yourself as customer service, if you want to improve yourself as an insurance agent between April, May, and June, this is a time to do it. Because in June, July, you're going to be swamped with recertifications. So I think this is you've got a really good window here to learn and again, to improve and to make yourself better. So today we've got United Healthcare at 11 o'clock. They're doing their Medicare Toolkit resources of the week. We've got some really cool stuff in there that they're loading, including the 2023 Medicare Made Clear materials, which is great leave behinds and used for marketing on your tabletops. They've also got some supplement information as well. So check that out. They've got a great thing in there, and that's at 11 today. They're also doing their virtual office sessions as well. So if you're interested in meeting with somebody at United Healthcare, talking about anything at all United, they're hosting that today at 4 o'clock, and then they've got another session Friday the 7th, this Friday at 3 o'clock to 5 o'clock. So those are virtual hours for anyone, so anywhere in the country, if you have questions, jump in that. Cigna's also doing that as well. So they're hosting theirs tomorrow at 9 o'clock. And again, they're doing one at 12:30 on Wednesday. So for Cigna, same concept. Here's some cool stuff happening tomorrow, sales improvement for Cigna. So if you're looking, like I said earlier, to improve your sales, to get better at it, Cigna's hosting a great session there tomorrow at 11. United Healthcare is doing a dental training. Dental's a really big thing, and we're going to talk about strategy here in lock-in, because offering dental plans to your members is another great way to keep that retention up. So we'll talk more about that, but they're doing a training tomorrow at 11. Check that out. Devoted is doing an election period training at 3 o'clock tomorrow. Very, very important, because in lock-in, the name of the game is find that SEP, find that special election period, and the only way to find them is if you know what you're looking for. So great training. I think this is probably one of the most important training this week is you got to know your election periods and how to find those SEPs. So that's tomorrow at 3 o'clock. Moving over to Wednesday, the 5th, we've got Ask Al, a coffee and chat session virtual. So we've got our own in-house. Mr. Al Clancy is available at 9:30 on Wednesday. So if you have any questions, concerns, anything that you need help with, he is there for you Wednesday, 9:30. Also about the same time, AvMed is doing their agent-only collaboration. This is a great way to meet the community engagement rep from AvMed. We're going to talk today about what you should be doing throughout lock-in, and events is really big. So anyone that's out there doing events, you want to be friends with them. So that's also on Wednesday at 9:30. Devoted's doing another election period at 12 o'clock on Wednesday, so check that out. And Cigna's doing a training for their DSNP products Wednesday at 4 o'clock. So if you're selling DSNPs, again, lock-in is a great time of year to do this. Everyone got reset on their election period for DSNPs, so you can actually change between April, May, and June. So if you bump into anybody that has Medicare and Medicaid, which we've gone over for Medicaid redetermination, this is really big. DSNPs are big, so you got to know about those products that are out there. Cigna is one of them. Moving over to Thursday, the 6th, Cigna's doing another sales improvement training at 11. Check that out. Devoted's doing a coffee and chat session for 11:30 on Thursday. And Humana's doing their 30, 60, 90-day conversation. There's guides there. So this is a great resource here. Just jump in there and you can download all the presentation decks for what you should be talking about with your members on day 3, day 30, day 60, day 90. Okay. Now there's some automation I'm going to tell you about with your CRM system with Spark. And I'm going to share a little bit about that, but there's still some things you need to be doing manually, and that is calling your members. Okay. So we'll check that as well. Friday the 7th, Devoted's doing another election period training. So if you missed the one on Tuesday, you can jump over on Friday at 9 o'clock, and they have another session there. Another Cigna DSNP session at 11 o'clock on Friday. And again, that's the training for the week. So lots to do this week. I really hope that you invest a little bit of time to improve yourself. This is a great way to get your chops right and to learn more about the business. So remember, guys, keep one foot in the classroom and the other one in the field at all times. All right, switching gears, Freedom put out an email last week, and it is for their national benefits here, the grocery program. And it lists all the grocery places that they can use physically, the retail locations that you can go into to pick up some of those items as well. They can also order them and it can be shipped. So I just wanted to dive a little bit deeper into this because there's some great resources, and groceries is a hot benefit right now. Seniors are asking about this. They're hearing about it. Their friends are getting grocery cards. And so this is making the phone ring. Okay, so you got to be really in the know with this hot benefit here. And I don't think it's going to go away. I think a lot of the health plans are going to double down on this particular benefit. So for Freedom, specifically Freedom and Optimum, you're going to have, your members are going to have access to use their grocery card at Walmart, CVS, Albertsons, Kroger, Micro Merchant Systems, that's in Miami, Mount Dora Pharmacy, Prime RX Pharmacy, Rite Aid, apparently not in Florida, Giant Eagle, and Subordinate Brands. That's also not in Florida, only when they're using outside of the state. Winn-Dixie is not approved, so just keep that in mind, okay? Also, if you scroll down, there's a couple of other great points here as well. It lists, what are some of the items that your folks can get using the grocery store thing here, and that is fresh fruits and vegetables, canned fruits and vegetables, frozen products, dairy products, meat, and seafood. So I know veggies are really big, meats are really big. Those are things that are hard to come by at food banks, but these are things that your members have access to. And just remember that the benefits do not roll over from month to month. That is important to know. Now, on the member side, when they get to the page to activate their card, this is what it looks like. So they can log in here. They can see how many dollars they have left in their grocery card. But initially, they're going to want to activate their card. So you'll see here, activate your card at the top. You're going to click activate card, and then they just punch in their card that they got. It's a MasterCard. It looks exactly like this. This is what the grocery card benefit looks like. It's administered by Nations Benefits, and they just punch in the card that they received to activate it, and then they can get those benefits that are listed in their particular plan. They do have a phone number that the members can call. And just remember that you also have Spark Member Services to help your members out in case they get jammed up or have a problem with the grocery card. I think that's probably going to be a hot ticket there, moving forward. And speaking about Spark, I do want to go through a couple of things here. The first one is they have activated what we call reminders, and this was, a popular request inside the platform. How do I make a note or remind myself to call? In this case, let's use Kelly Abbott about her Medicare on tomorrow. She said, hey, call me back tomorrow. So in order to do that, you're going to go to her profile page here, and you'll scroll down. On the bottomish right here, you'll see add note, files, or reminder. You're going to click that, and you can add a note, which will list it right on top of her profile here. And you can pin it to the top if you want. But reminders is a great feature. So let's say, like I said before, you want to remind yourself to call her tomorrow. You're going to click, tomorrow as the date, and then, whatever that note is, call about Medicare. Okay. You can put, whatever plan they're on, and maybe they're, a patient at WellMed. So, hey, I got to look at my WellMed doctors in the area to make sure that I keep her with WellMed, right? So you're going to click that the reminder button there, and that will save it here. And the reminder will look like this. And when tomorrow comes, it'll pop up on your little bell at the top right here. Let me make my cursor so you guys can see it there. So the bell will pop up here. And if you want more information about the reminder itself, you can come down under her file and click there. It'll take you right to her profile. So as things happen on the activity level, you'll be able to see everything that's happening here. So there's my reminder for tomorrow. You can filter it out. You can look for your members, but it will pop up in the top right there. So that's the first thing that's changed. The one thing I do want to point out is when your members first get enrolled, if you've opted into the postcards, your member's going to get a postcard right out of the gate that looks exactly like this. Okay, this is an example of your postcard. It's customized with your member's name, okay, and the plan that they just enrolled in. Okay, so in this example, thank you for choosing me to handle your Medicare insurance needs. By working with me, you not only get a plan, but a team to help you with your healthcare needs. An enrollment letter from WellCare verifying enrollment in your plan. And here's what to expect. So this is great. So this postcard actually gets to your member before their ID card does and their letter does. So it just, helps create that stickiness, that retention for you and your member. So as long as you set up your platform, as long as you've loaded your picture and your colors, we've got the logo for HPM if you want to use that. That's loaded in there, and then you just put in your return address. So all that's done for you. It's automatically loaded, and your member usually gets the card within 3 days after you've done the application. So just a little thing I wanted to remind folks on, because we're in lock-in now. OEP. One of the things that I would highly recommend right now in OEP, that has come to an end, is review what you did, look at what worked, look at what didn't work, because now's the time to improve on that, and take a look at some things that you might want to double down on, right? So if you want to work on networking, or maybe you want to step it up with working with doctors, this is the time to do it. Okay. So on that note, we do have Miss Shannon from WellMed on the line. Shannon, can you hear us?
Yes, I can hear you. Can you guys hear me?
Yes, awesome. Thank you very much for joining us this morning. And again, guys, Shannon's from WellMed and Optum, and she's going to give you the lowdown on what's going on in her world. So thanks again for joining us, Shannon.
Absolutely. Thank you guys for having me. And if I can steal the screen, I'm going to kind of run through a presentation. It's going to be very high level, but it's going to hit on some of our highlighted points that we do in clinic. And then obviously, if there's any additional takeaways that, you guys have, feel free to reach out and let me know. I will be putting my information in the chat box so you guys can go ahead and reach out to me. So as I mentioned, I'm Shannon Fugelsang. I'm the Director of External Partners. So I'll be that point of contact for you in your boots on ground efforts in regards to co-funding, co-marketing, and any types of grassroots efforts when working with our clinics. So we are Optum WellMed, and moving into the next slide, just kind of let me know if it's moving with
Yep.
the screen with you guys.
Good to go.
Okay, perfect. So the agenda, we'll just do a quick overview and footprint, as I'm not sure if you guys are all from the Orlando territory, if you're widespread, a little bit on our services, and then our agent resources, and then I'll quickly run through some of the target clinics. But again, if there's additional information that you guys would like, I think it would be best just, feel free to reach out to me afterwards. So in regards to our footprint, we are kind of scattered all across Florida, so we do have one of the largest MSO groups within Florida. Our major areas are going to be Tampa, Orlando, Treasure Coast, Miami, and Southwest Florida. But when you're considering encompassing also our contracted groups, we do have a very vast membership as well as provider footprint across Florida. And so those are going to be all of those Optum and WellMed branded clinics that are going to be on those main territories. And then when we get into some of the next slides, you'll see that we partner with some of our contracted groups such as Millennium, Florida Medical Clinic, Aegis, and Ocala Family Medical Center. So these are probably some of those other more recognizable names that we do partner with. Now, it is important to notate that the Optum WellMed brand, our employed brand, are going to be the 131 clinics that we have across Florida that we have the most say in kind of how their operations work. So we work more closely with those individuals, and we are, really embodying that standard of value-based care that we want to treat your client with the best care possible, as well as we just have the ability to streamline any issues a little bit better for you guys. With that being said, we also have over 1,000 different contracted providers that reside all across Florida as well. So not that we don't have a great connection with them, but we do kind of give them a little more leeway in how they run their operations, but we can still, help coordinate and, streamline any issues on that side as well. Moving into the next slide, just the health plans that we accept. It is important to notate at the bottom left that the plans do vary by location, as well as dependent on whether it's a WellMed or Optum owned clinic. But in all general terms, across all of our clinics, we try to accept these 5 main healthcare plans. So we do accept some of the bigger plans, and we are working to accept all of these different healthcare plans at all of our clinics. But we do know that these are some of the most competitive ones, especially hearing you guys have some different opportunities with Freedom previously, as well as Humana has been huge in the market this year. So we do feel that these definitely take a good consideration into all the different plans out there. We do kind of support some of the most popular ones for your clients. So a little bit into our services. It's going to be very, very high level because obviously it's definitely a little more in depth once you get into it. But some of what your members or your clients going to experience is that we do annual wellness visits, preventative screenings, and focus on HEDIS quality measures and gaps. That means we really do put your client in their first appointment above, kind of the other individuals, and we try to get them in there at least seeing them for 30 to 40 minutes in that first appointment versus other, MSOs or fee-for-service settings where they may get a 15 to 20 minute segment with their provider. So we really go into depth, understanding what this client's specific needs are, and then we move into kind of putting them into a tier. So how we continue to keep these individuals healthy is that we put them into different bandwidths, band 1 through 5, and being that if they are extremely, in need and have, health concerns, they're going to be seen more than those individuals that are healthy and kind of thriving on their own. That's not to say those healthy individuals aren't going to be seen, but those band 5 individuals can be seen up to 3 to 4 times a month. So I think that would, eliminate some of the concern of whether if you're putting a unhealthy individual with us, if they're going to get their care needs, if we're going to make sure to keep them, healthy, they will be put at our priority list. And then we won't kind of be bothersome to those, other members that may be healthy and kind of still working out and on their own. We won't kind of clutter their schedule with unnecessary appointments, and we'll really, continue to watch their care throughout the time frame that they're with us. We also assign several different individuals that care for this specific member and your client. So not only is it going to be for the provider and the nursing staff, but we really have a care management team that encompasses 4 or more individuals focused on that specific person's care. So it's really almost impossible for anything to slip through kind of the cracks in regards to their care. We do tend to, reevaluate these members every time they come in, and have a lot of individuals and data that helps us, really focus on that person's care and bring them in if necessary, as well as, just continue to check in with them throughout their time. So, other MSOs maybe have, a little less support, but we really have a village to take care of each and every single member. Some of the other individuals that are on our teams, as you can see, there's a slew of them on the right. So we have no shortage of care and kind of specificity to each of these members, and they really should have a lot of resources to help, kind of improve their care. We also do evaluations and assessments, and some of those include home safety evaluations, medical evaluations, geriatric assessments, and annual screenings. We also do transitions of care, and that's going to be, advanced directives, serious illness conversations, as well as we have our clinic staff that's 24/7 on call for these clients. So, hopefully that will keep some of those ER visits down, and some of those, more emergency things at bay when they have the ability to connect with us 24/7. Some of the medical procedures that we do in our clinics are lab drawings, immunizations, wound assessment, and the life symptom management, and then therapeutic injections. So all these different things that we do in clinic to maintain that individual's health and really keep our staff as up to date on everything that's going on with that patient. And then we also have, the care and social support. So we do a lot of hospice referrals and coordination, psychosocial and spiritual care, caregiver burnout assessments, and social service assessments. So all of these are additives that we give to our patients, and, we continue to provide them the resources to make sure that they're healthy in our offices, but also when they go home, we don't drop that point of contact. We really keep them involved in their standard of care, every single day. So hopefully that will, alleviate the need for you to worry about, your retention, and we can just make sure that your individual is healthy and cared for. And then you guys can be more focused on, gathering those leads and continuing, getting more on your book of business. We also have some of our wraparound services. I think it's important to also notate that these are going to be, subject to assessments by each individual member and client. So this isn't a one size shoe fits all, as well as it's not a one clinic fits all, as we do have some differences from the Optum and WellMed brand. But we do have, in general terms, a lot of different vendor services. We have mobile units that go out that can do some blood work, Comfort Care that does some of our transportation services, Home Care Dimensions, and Optum RX. So a lot of different kind of benefits that they get when they're, placed with our clinic on top of the additional support. They can also utilize these, and, like I said, they are dependent on some assessments, but we truly give all those individuals that are in need of these additional services, they will have access to it. We also do telemedicine. I think that was important, moving out of COVID, but as we were able to be adaptable during that kind of virtual world, we did move into a telemedicine on-demand access. We also provided grand pads to our clients, and still do this to this day for those individuals who don't have access to iPads and those different types of technologies to take advantage of this. So if your client is one of those individuals that cannot get out of the home, cannot utilize the transportation systems, telemedicine is still something that, we provide for our clients, and we'll do that ongoing, as we definitely want to be as versatile and adaptable to, the ever-changing environments. And we are aware that, some individuals just cannot, get out of their homes. So we definitely want to bring that care to them. So on top of those in-home treatments and house calls, we also have this telemedicine opportunity as well that is 24/7 on top of being able to contact our clinics 24/7. So again, this is just another overview of all the different individuals that really do concentrate on your client and our members. So it's not just the provider and the patient, or even, just a PA or a nurse that, focuses on your client. we have a slew of individuals that really do coordinate care with these individuals. And on the Optum side, we also have an employee hospitalist. So it's not listed on here, but that's mainly because, as I mentioned, the differences between WellMed and Optum, they aren't a great amount of differences, but there are some different benefits on one versus the other, and it would depend obviously on which your client would need the most, as well as relatively how close an Optum or WellMed clinic would be from your client, whether it would be right to place them with one or the other. So now just another overview of what we do for you. So we're patient-centered. We have all these individuals really focused around, your client, and we build those strong relationships to make sure they're not just another number in our clinic. We have a strong relationship with the provider and the member. They get that 40-minute first appointment, and then from there on they still get lengthy appointments every time they're in there. And then again, we bring them in bandwidth tiers. So the more needy that a person may be health-wise, the more they'll get to be in the clinic and really be focusing on their care and have a lot more additional assistance. We coordinate the care, and we use data to do that. So with all the different people that we coordinate and that we work with, we make sure to have the most up-to-date information every time that you're seeing that provider. So he has all the different information, and whether that is, going to see a specialist or you're going to a hospital stay, we make sure that our providers and our care team are really centralizing all of that data so that they can really address the client's concerns, holistically, and not just have, one-sided view of that patient's health. So now kind of what's in it for you guys? How do we help you outside of, what we're doing for your clients, outside of, how we help your clients stay healthy and help you focus on, getting new business as opposed to, worrying about the retention and your patient remaining healthy. So some of what we do, like I said, is focus on the retention, and the lead generation is up to you guys, and hopefully that you guys can, focus on that, because we know that is a full-time job, and we definitely appreciate you guys kind of going out there and not only grinding during the AEP season, but year round. We focus on the client satisfaction and our patient satisfaction. We have a broker liaison team under myself and a provider marketing liaison team under my counterpart, Josh Lopez, that is out there to help support you guys, as well as we have our online and in-person support. We have opportunities to do co-branding and co-marketing efforts. So if there's ever time you're out in the field and, you feel there's an event that aligns well with our clinics and you would like to, work alongside us or have us sponsor you at an event because you think it's a optimal area to work with, clients that may want to go to our clinics, we're more than happy to, help sponsor you in that event, either, using marketing funds or even just kind of providing collaterals and materials to help you kind of broadband our kind of brand and value added services. We have online resources. So the agentsinflorida.com, it's a pretty easily accessible website, and it's inclusive of all of our directories as well as a lookup tool for all of our clinics. So you can kind of filter that and go through, based on the age demographic, based off language barriers. If they speak Spanish, you can kind of filter by that. You can filter by zip code, as well as you have a premier client onboarding website on there. So that's important because you'll be able to schedule your member's first appointment on there, and then you won't have to make that call and do that yourself. What will happen is that intake form will come to us, and we'll make that outbound call to schedule that member's first appointment. So it frees up a little bit of your guys' time to, like I said, focus on those leads, focusing on those marketing events, and not really have to set up those appointments for those clients you guys are seeing. Again, we do the marketing resources. So if there is anything that you would like to, work with us on, I would say the best point of action is to either reach out to your territory specific broker liaison or PML if you know them. And if not, either myself, my information is on the screen, and I will also drop it in the chat, or my counterpart, Josh Lopez, who is also on the screen. And then to finish it up, I'm just going to kind of run through the target clinics that we have. So these target clinics were established for those clinics that are most available and open to growth, as well as may have those conversion patients in clinic. So these are going to be the clinics that have been identified as, they need more individuals and they can take that volume as well. So you shouldn't have issues getting first appointments. And typically we try to make that first appointment within the first 30 days. But if you need it urgently and you kind of push that through to us, we can definitely get them in there in a more timely manner and make sure they're seen as soon as their benefits are available to them. So we've got quite a few of these different, like I said, we have some of the largest volume of clinics in Florida. So we have a ton of locations with a ton of availability. So if you ever do run into any issues in getting access to any of our sites, getting information or coordinating with us, I would say to just streamline those issues to me and I can definitely help you guys. I know it was a lot of information, but I did not want to take up too much of your time because I saw you guys had such a large agenda today. So that is kind of the overview of the Optum WellMed brand. And like I said, I will be putting my information in the chat box if you guys have any other questions.
Shannon, that's phenomenal. Thank you very much. And when you have a moment, could you send us that list to Nick or myself? The target clinics that you're looking to grow, because we're always looking for agents come on board and they want to work with providers. And just as a reminder, guys, we have training on our side, but so does Optum, and they have an agent academy. So Shannon, can you kind of talk about like what they would learn in that agent academy?
So in that Agent Academy is going to be mainly a lot of this information, but more expanded. So it's going to be a little more in-depth information on that first appointment. It's going to be a little more in-depth information on our value-added services and how you can utilize them and who you can go to. So this is just that very high level visual of it, but then think of an hour-long version that kind of gives you a little more in-depth experience.
Perfect. I know we talked a lot about Florida, and we know WellMed and Optum are in certain areas, but I understand you have affiliates. Are you guys in other areas and other markets as well?
Yeah, so Millennium Physician Group covers the Southwest Florida territory and kind of goes up and over. And then we have a lot of our contracted partners in Northeast Florida. I would say Northeast Florida is going to be primarily contracted individuals up in that location, but we do kind of have them spread all throughout. I would say Southwest Florida, Tampa, Orlando, and up into Northeast Florida is where our kind of strongest presence of associates and affiliated clinics would be.
Got it. Got it. All right. So, and you've seen, you're in the marketing, you see what's going on out there, and we're in lock-in now. What would be your advice for us as agents to say, hey, it's lock-in, we're here, we're WellMed. What's best practice? What would you say we should be doing right now, to the agents to grow their book of business and also to, work with you guys?
Yeah, I mean, I would say if you've got ideas on different types of events that you guys are doing that we can help, fund you guys for, we're definitely open to doing that with you guys. HPM has been such close partners for such a long time. So we definitely know that you guys, are responsible with your clients, and we are happy to kind of help you guys manage their health. So I would say if there's things that you're doing out in the field that you need help for, the best case of action would be connect with me, and we can definitely see what kind of monetary funds we have to support you guys. Other than that, obviously moving into SEP, we're going to be kind of ramping up to support those plans, those DSNP plans, and T65 campaigns. So that's going to be our strongest players at this point. I know we also are working with Al a little bit to get some agent trainings in our mix centers. We do have some centers that you guys can utilize when they are vacant. So if you ever need a space to host your own event, they are located adjacent to an Optum clinic, but not to be, specific to an Optum or WellMed, different type of branding. It is space that can be leveraged for you guys if you would like to put on events. So, just another additive that we could offer you guys as well.
That's amazing, and thank you for that. We appreciate it. Space is either hard to come by or very expensive. So,
Yes.
yeah, we appreciate that very much. Yeah, Shannon, thank you. This has been absolutely fantastic. Again, guys, if you have questions or you are looking to work with WellMed, you could reach out to us, or you can reach out to Shannon. Her information is in the chat there. And Nick is kind of running point as well, so You know, if you have any questions, you can always reach out to Nick as well. We want to partner you with a provider. So this is a great opportunity to do that. If you're not working with providers, please reach out to us because they are excellent partners. Like Shannon said, they'll support you in your marketing, they'll support you in your events, but most importantly, they're going to help with the stickiness, the retention. When you put a member in WellMed, they're going to keep them there as much as they can. They're going to try their best. So you have a partner to retain your business, and that's really the most important part of this. So Shannon, thank you again. We really appreciate your time this morning. And
Absolutely.
and that's what we'll do. So guys, thank you all for joining us this morning. Same time, same station next week. We really appreciate you guys taking time this morning to be on the call. I hope everyone has a fantastic week. Take care.